In this video, we talk about whether it's truly possible to make your penis bigger naturally, and how this question causes quiet concern, confusion, and sometimes embarrassment for many men, how you can feel more confident and informed by following safe, sound guidance. Make sure to watch until the end, because what we cover might just change how you think about this. Let's start by being honest. This is a question most men never ask out loud. You might see a flood of online ads, exaggerated before and after photos, or so-called miracle techniques claiming to increase size naturally. And if you've ever searched for this topic, you know just how quickly the information turns vague, misleading, or even unsafe. And yet, as men age, they still hesitate to talk to a doctor about these concerns. The topic feels personal, maybe even shameful, as if wondering about it means something's wrong with you. But it doesn't. There's a lot of emotion tied up in how men feel about their size, but very little trustworthy information out there. That confusion creates a perfect storm for myths, scams, and silent self-doubt. Some men have tried herbal oils, stretching routines, or vacuum devices without knowing what the risks are. Others feel skeptical, but still curious. And many are just quietly frustrated by all the noise, wishing they could hear a real answer from someone they trust. So let's take this one step at a time. We'll talk about what really determines size, what actually changes and doesn't as men age, and whether any natural method has been clinically shown to work, even slightly. We'll also talk about how your confidence, function, and comfort in your own body matter just as much, and how you can safely support those things starting today, without chasing false promises. What comes next might really surprise you, because the truth is far more grounded and far more encouraging than what you'll find on most websites, forums, or product ads. If you've ever typed this question into a search bar, "Can I make it bigger naturally?" you were probably met with an overwhelming list of claims, ads, and questionable advice. Things like, do this simple stretch every day for 1 inch of growth. Take this herbal supplement and see visible results in weeks. Try this device for 30 minutes a day and change your life. It's everywhere, and it's easy to understand why so many men feel confused or even hopeful. But what does the actual medical research say? Let's start with the basics. According to the Cleveland Clinic, there is no proven natural method to significantly increase penile size once puberty is complete. The size you have in adulthood, both flaccid and erect, is determined by a mix of genetics, hormones, and developmental factors that cannot be safely or permanently changed with pills, creams, or exercises. Now, that doesn't stop the market. In fact, a report published by the National Institutes of Health, NIH, notes that the global male enhancement industry is worth billions and largely unregulated. Many products are sold online without scientific testing, without transparency about ingredients, and without long-term safety data. Let's look at some of the most common claims and compare them to reality. Stretching exercises like jelqing. You'll often hear that stretching the penis repeatedly can create microtears that heal into more length. But no high-quality medical study has ever confirmed that this works. And many urologists warn that repeated pressure or aggressive movements can actually cause nerve irritation, vascular damage, or curvature over time. Vacuum pumps. These can sometimes create a temporary swelling effect by drawing blood into the shaft. The Mayo Clinic confirms that while pumps can be medically helpful for some men dealing with erectile challenges, they do not increase permanent length or girth. The effect typically fades within a few hours. Pills and supplements. From ginseng to L-arginine, many ingredients are advertised to enhance performance or increase size. The truth? Some of these supplements can support circulation or hormonal health, but none have been proven to increase anatomical length or width. And some products contain hidden prescription drugs or unsafe fillers, topical creams, or oils. Despite bold claims, no cream or oil applied to the skin can change the internal tissue structure of the penis. Harvard Health points out that skin absorption of active ingredients is minimal, and any tingling or warming sensation is often a result of skin irritants, not actual tissue change. Traction devices. This is one of the few methods that has been studied clinically, with mixed results. Some small studies, such as those referenced in the Journal of Sexual Medicine, found slight increases in length, often a few millimeters to about half an inch, after consistent, daily use over 6 months or longer. But even these results came with risks of discomfort, skin changes, and extremely slow progress. And importantly, girth did not increase. Now here's something most men never hear. Medical societies like the American Urological Association do not recommend penile enhancement procedures, surgical or non-surgical, for men with normal anatomy and function. The risks often outweigh any benefit, and many men report disappointment, pain, or complications after pursuing unrecommended unregulated options. But that's not the full picture. We'll explain why soon. Because even though the answer to can you make it bigger naturally is, for the vast majority of men, no, not in the way you might hope, that doesn't mean nothing can improve. There's a big difference between actual size and perceived size, performance and confidence. And that is where the science gets more interesting and more useful. What matters most for men chasing risky procedures or miracle supplements? It's understanding what's really changing inside your body, what's normal, and what you can do to feel stronger and more assured in the years ahead. Now here's where it gets interesting and far more hopeful, because while the actual size of the penis is mostly set by the time a man reaches adulthood, many of the factors that influence how it looks, feels, and functions continue to change as you age. And most men aren't told how this all works. Let's start with how penis size is determined in the first place. During puberty, your body goes through a surge of testosterone and growth hormones. These signals stimulate the development of the genitals, just like they do your voice, your muscle mass, and your height. By the time a man reaches his early 20s, that development is typically complete. The length and girth of the penis at full maturity are based on genetics, just like eye color or bone structure. After that point, the tissues no longer respond to growth hormones in the same way, which means no natural diet, exercise, or supplement can restart that growth phase. But here's the key. Even though the underlying size doesn't change much, how the penis appears and functions can change dramatically depending on a few core factors, especially in your 60s, 70s, and beyond. For example, one common concern among older men is that their penis seems smaller or less full than it once did. But in most cases, that's not due to actual tissue loss. It's due to changes in blood flow, connective tissue elasticity, body composition, and hormone levels. Let's break that down. As testosterone gradually declines with age, a process called andropause, many men experience a combination of symptoms: reduced libido, softer erections, decreased morning arousal, and sometimes a subtle loss of confidence in their intimate life. All of this can influence how a man perceives his body, including his size. At the same time, blood vessels become less flexible and nitric oxide production, a key chemical for erection quality, slows down. That means the same amount of tissue may not fill or expand the way it used to during arousal, leading to the appearance of shrinkage, even if the actual dimensions haven't changed. Body composition plays a role, too. As abdominal fat increases, especially around the lower belly and pubic area, the visible portion of the penis can appear shorter. In reality, the structure is still there, but more of it becomes hidden beneath the surrounding tissue. A study published by Harvard Medical School noted that for every 30 to 35 pounds of weight gain, the visible length of the penis can decrease by about an inch, not because the penis shrinks, but because it's buried beneath the fat pad. Another factor? Scar tissue or fibrosis from long-standing medical conditions like diabetes, high blood pressure, or Peyronie's disease. These can subtly affect the shape, curvature, or flexibility of the penis over time, which may cause some men to feel like things are less than they used to be. But here's what I want to emphasize. You're not broken. You're adapting. And adaptation doesn't mean failure. It means your body is signaling changes that are part of a normal aging process. It's not your fault, but it is your body talking to you. And the good news? When we understand what's really going on underneath, we can shift the focus from unrealistic goals. Because there's another layer to this conversation, one that often gets overlooked in all the noise about natural enhancement. And that's the fact that confidence, arousal, satisfaction, and intimacy are all deeply connected to your physical health, emotional well-being, and relationship dynamics. In many cases, what improves a man's sense of satisfaction in his body has less to do with changing its size, and more to do with improving how well it works, how good he feels, and how connected he is with himself and his partner. This leads directly into the steps we'll share in just a moment, and they're simpler than you might think. First, focus on maintaining a healthy weight. Excess fat around your lower belly and pubic area can physically conceal part of the penis, making it appear shorter. Research from Harvard Medical School confirms that weight loss can help reveal more of the shaft and improve self-perception. So, balanced nutrition combined with regular physical activity is a foundational step. Not only does this help your appearance, but it also benefits your overall cardiovascular health, which is crucial for good blood flow. Second, prioritize cardiovascular fitness. Your penis relies heavily on healthy blood vessels and circulation to achieve and maintain firmness. Activities like walking, swimming, or light jogging improve endothelial function, that is, the the health of the lining inside your arteries, which helps with better blood flow throughout your body, including to the genitals. A 2020 study from the Mayo Clinic showed that men with good cardiovascular health are more likely to maintain erectile function longer into their later years. Third, address hormonal health safely. Testosterone naturally declines with age, but that doesn't mean every man needs hormone therapy. Simple lifestyle habits, such as getting quality sleep, reducing chronic stress, and eating a balanced diet rich in zinc and vitamin D, can support your body's natural hormone balance. If you're concerned about symptoms of low testosterone, talk openly with your healthcare provider about safe testing and treatment options. Avoid unregulated supplements or treatments promising quick fixes. Fourth, consider pelvic floor exercises. Strengthening the muscles around your pelvis, particularly the pubococcygeus muscle, can improve rigidity and control during intimate moments. These exercises, often called Kegels, can be discreetly practiced at home and have been shown in clinical studies to help men enhance their intimate function and confidence. Fifth, be cautious with supplements and devices marketed for enlargement. Many are not regulated by medical authorities and may cause harm or have no proven benefit. If you are exploring supplements, look for those backed by credible research and recommended by healthcare professionals. For example, L-arginine, an amino acid that supports nitric oxide production, has been studied for its role in improving blood flow, but its effects are modest and should be part of a broader health strategy, not a standalone solution. It's important to understand that it's not about fixing everything overnight. It's about smart, consistent action that supports your overall health and well-being. These steps not only contribute to how you feel and function, but can positively influence your self-image and intimate satisfaction. What matters most is embracing realistic expectations, understanding your body's natural changes, and focusing on measures that improve quality of life and confidence, rather than chasing unattainable size changes. And always remember, all information provided in this video and channel is for educational and informational purposes only. Always consult a medical professional about your specific circumstances and before making any changes to your lifestyle, diet, supplements, or medication.